All right, I'm very delighted to introduce Dr. Angela Cooper Brathwaite, our presenter for today. Let me just do that. Okay. Dr. Angela is the immediate past president of Registered Nurses Association of Ontario, the chair, a co-chair of RNAO's Anti-Black Racism Task Force, adjunct professor and graduate faculty member at Ontario University, Technology University. She holds a PhD in nursing from University of Toronto and a Master of Nursing from the University of Manitoba. She has extensive experience in leadership, nursing administration, nursing education, policy advocacy, healthcare system, and cultural competence consulting. She has held executive leadership and positions in primary care, acute care, public health settings, and taught undergraduate and graduate nursing students. Through RNAO, Dr. Angela is engaged in policy advocacy at the local, provincial, and federal levels, speaking out for health, speaking out for nursing, and numerous issues. She has also received numerous academic and service awards and was a recipient of the RNAO 2013 Leadership Award in Political Action in 2011, Leadership Award in Nursing Administration, and 2015 Award of Merit. She also received the University of Toronto Distinguished Alumnus Award in 2007 and Ontario Public Health Association Award of Excellence for Leadership in Public Health in 2010. She has published numerous peer-reviewed papers in professional journals and was instrumental in establishing the International Nurses Interest Group of RNAO in 1998. Her areas of research are chronic disease, focusing on the prevention of type 2 diabetes, and culturally tailored interventions research. Welcome, Dr. Angela.
Thank you so much. It's my pleasure and honor to talk to you today on a key topic here called Impact of Racism on Black Nurses and the impact it has on the healthcare. Could you move the next slide, please? And again, we'll go straight to what's okay. So today for my introduction, I would just like to make a comment from Dr. Martin Luther King Jr., who was an activist in the United States. And he said, injustice for one is injustice for all. Racism is a learned behavior. So you could learn it from your parents, from society at large, from your school. And according to Anzadua, 1990, racism is a major issue for people of color that overshadows every aspect of their lives. Racism leads to profound harm to Black people, Indigenous peoples, and people of color where they live, work, and are educated. Next slide, please. So the objectives for our presentation today is increase participants' awareness and knowledge of systemic racism and its impact on Black nurses and nursing students' mental health. Enhance participants' knowledge and strategies to address systemic racism in nursing in academic and workplace settings. Increase participants' skills in dealing with mental issues in their personal lives and to generate support for Black nurses, nursing students, and racialized groups who are experiencing racism. So I'd like to share a few definitions with you. Today, I'd like to talk about individual racism and institutional racism. Individual racism refers to the expression of racist attitudes in the behavior of individuals in face-to-face situations. And institutional racism refers to the complex structures and processes which function largely independent of prejudice or intolerance of individuals. Next slide, please. Microaggressions, they are brief, everyday slights and insults, indignities, and denigrating messages sent to people of color by well-intentioned white people who are unaware of the hidden messages being communicated. Microassaults are conscious, intentional, discriminatory actions using racial epithets, displaying white supremacist symbols like swastikas, and even for the Black people, when you see a noose hanging outside your door, that's a threat because they hang the Black slaves when they were running away on the noose. So that's a threat to the Black people. Microinsults include verbal, nonverbal, and environmental communications that subtly convey rudeness, insensitivity that demeans a person's racial heritage or identity. There is a paradox about racism. For me, the paradox is, as healthcare providers, we are healthcare providers, we nurses, whether you're RPNs, RNs, nurse practitioners, even social workers, we are healthcare providers. And we are expected to provide compassionate, client-centered care to patients and their families. Yet, we treat some members of the health team, our peers or our subordinates, as outcasts. We perpetrate racism against them without thinking about the serious harms and the trauma it would cause us. There are very few research studies that are focused on the mental health impacts received as a result of racism. Most of the studies done in Canada in 2001, and that was Hagee and colleagues, as well as Das Gutas in 1996, they focused on racism in minority groups. So Blacks were included in that, and they found out that racism has a profound impact on the mental health of people. And other studies that have looked at mental health, they've looked at it from patients' perspective, not on our colleagues, nurses. So RNAO did a study, a survey in 2005 on racism. And also we presented a webinar on racism, the impact of racism on Black nurses. And I'm sharing the poll with you from that webinar. It showed people who attended that poll, 81% had experienced racism and microaggression. 30.2% said systemic discrimination and racism strongly affected their mental health, and 32.7% said systemic discrimination and racism moderately affected their mental health. So if you combine the last two, you have at least 62.9% people who have experienced racism who were in that webinar. Next slide, please. In 2005, and that was November, RNA conducted a survey, and this was done via online, and 181, which is 88.3% of participants reported that they experienced racism or discrimination. 63 or 30.7% felt uncomfortable in the academic or work setting. 61 participants or 29.8% felt very uncomfortable in the academic or work setting, and 43 or 20.9% felt slightly uncomfortable in the academic or work setting. Next slide, please. So this slide shows, we asked, one of the questions we asked, as a Black nurse in Ontario, do you believe you have experienced racism or discrimination? And you would see from this slide, 88.3% said yes, they had experienced racism or discrimination. Next slide, please. The next question we asked, on a scale of 1 to 5, to what degree has experiencing systemic discrimination and racial microaggression affected your mental health? 32.7% said it moderately affected them, and 30.2% said that it strongly affected them. Next slide, please. There was a study done by Halls and Fields in 2015. And again, this is not just nurses, it includes Black people. The effects of microaggression on mental health include insomnia, social isolation, weight loss, depression, they're unable to work, anger, helplessness, hopelessness, a sense of betrayal or social guardedness or watchfulness, and post-traumatic stress disorder. Next slide, please. Black Lives did a study on Black people, and again, this is not just specific to nurses, it was all Black people. They reported that Black people experience feelings of disconnection, second-guessing things or oneself, decreased trust, worry, increased risk of depression and anxiety, trauma, feelings of powerlessness, and panic. Next slide, please. So since we know that racism affects our mental health, whether you're racialized or not, whether you're Black, you're indigenous, it has profound impact. And therefore, I would like to share some protective factors to improve mental health. And some of these protective factors will help you to better be prepared if you are experiencing stress or any impacts like mental health from racism in your life or work or wherever you are. And some of these self-care include physical activity or exercise. And I would like to emphasize how important physical activity is. World Health Organization a few years described physical activity or exercise as the #1 cure for many illnesses. And when they say that, it prevents, it's more preventative. If you are physically engaged, you will decrease your stress level, and the chance of getting diseases like cancer, type 2 diabetes will be decreased. Because physical activity, if you do 10 minutes of it, it raises the endorphins, okay, they are released, it boosts your mood. And I remember working in a mental health institution in Manitoba, and we took our patients who were depressed for a walk of 15 to 20 minutes every day in order for them to get that impact. So the endorphins to be released, and so it will help to reduce the depression and help to elevate the mood. Adequate sleep and rest. These self-caring practices will help you if you are facing stress, any form of adversity. A good night's sleep helps you to rejuvenate. When you sleep well, your body rejuvenates. Your mental thought processes have become clearer. Support from your family, support from friends, your church family, your faith and spirituality all help to improve your mental well-being. Access to social and mental health services also help you. A sense of belonging and positive surroundings. And you find people who are engaged with different types of groups really help to help them to resist or to succumb to adversity, because they have a sense of belonging, they have the camaraderie, and they could talk to the colleagues who belong to that group, and it really helps them to reduce some of the stress or look at alternative ways to respond. Again, people who have some housing and employment and financial security, and this came from Ottawa Public Health, again, also a good protective factors. So it helps you to build that resistance against things like racism and criticism and stress, regardless. So other strategies. I like to look at some of those in academia and the workplace on an individual level, and then look at it from an institutional level. Don't hide the problem. And right now I'm in the process of reviewing about 10, 15 articles about Black nurses in the United States who have experienced racism, and they are afraid to voice it. And even when we did our webinars, some of the nurses who attended the webinars that RNA will give, they are afraid to voice it because they're afraid of backlash or retaliation. Even the survey we did identify people who are afraid of retaliation. But that's why racism continues to persist, because people are afraid to voice their concerns. I would like to encourage you, if you experience racism, to document the date, the time, what was said, any witnesses to the situation. And if there are a group of you who are experiencing the racism, working on the same unit, or if you're a student in the same class, get a list and go to the person on top. Go to, for example, if you are in an academic setting and you're experiencing racism, go to the dean. I'm saying bypass, even unless you have a very supportive mentor, go to the dean. If you are in a hospital setting and you don't have that support from your manager or your director, go to the chief nurse or even as far as the CEO. And I will tell you, by sharing those experiences with those leaders, they have a responsibility to act on your behalf. Do not be afraid. I'll give you two examples. When I went back to do my undergrad degree. I came to Canada as an RN and as a midwife. I was practicing in Northern Newfoundland. I returned to do my bachelor degree, and I had a teacher in my second year who was racist to me. At the time, I did not know what racism was. I'd never experienced it in my life. She was teaching me a course. She was the teaching theory as well as supervised my clinical practice. I had an A, my grades started dropping to B, even B minus. I went to the dean and I said to the dean, this is what's happening to me. My papers, I am getting a lower mark. This is what my previous grades were. I am getting these lower marks. I did not know at the time it was racism. But this woman used to make this comment to me, you are so young, you are so, you have achieved so much already. You are a midwife, you're RN, and now you're working towards your beard. And I was saying, but what does this have to do with my clinical practice? At the time, I did not realize she was mentioning a stereotype that some white people have about Black people. They feel we are underachievers, that we can't achieve. And at that time, I didn't know what she meant. But this is what I said to Didi. This is what this teacher is saying to me. My papers are being marked down, and I would like to change her as my clinical supervisor. The dean said to me, all students who are dissatisfied with their grades will have the paper marked by a second reader. But she said, unfortunately, we could not provide for you a clinical supervision from somebody else for public health because they were limited in people who were supervising the public health experience. I told all my friends, by the way, I was the only Black student in my class, 40-something of us. I told all my colleagues, my white colleagues were very supportive of me. I was able to discuss it. I told my church family, they were some of the lifesavers because they encouraged, they supported me. Eventually, 2 weeks before the final evaluation, I had written 4 pages to attach to my final evaluation, regardless of what she had written. And before that occurred, I met with her for my last one-to-one before that final evaluation. And I cannot remember even today what that woman said to me. And I started to weep uncontrollably for over 15 minutes without stopping. And everybody on that floor heard me weeping. It was very loud. And by the time I was able to recollect myself and open the door, there were all those other teachers, they were all white, outside that door, listening to what was happening to me. And this woman was so afraid, she said to me, you are going to make me lose my job. You are going to make me lose my job. I left her. The next week, I had my evaluation. She gave me a perfect evaluation. I moved on to the last year. In the last year, she never came back to the university. I do not know up to today what happened to that woman, whether she was fired, but the teachers knew, the dean knew, the students knew, everybody knew what I was experiencing. I did not hide it. And because I said it, and I said it to the most important people, it made a difference. So seek help from your academic advisor if that person is supported, your nursing director or your dean. I usually go to the top. I'm telling you, I don't stay low. I go straight to the top. So in academia, when I was teaching in Winnipeg at Red River Community College, again, all my content was told me what I had to teach. The first year I worked very hard. First year in teaching is difficult. Everything was in my filing cabinet. 1 week before I taught that content, came back to the college, all my content had disappeared. I did not hesitate to share it with everybody. At the time, I did not know who it is wanted to really hurt me. So those are some experiences. And if you are experiencing those things, I said, don't be silent. Go to the people on top. And if your organization has an equity and diversity and inclusion committee, make an appointment, go to the top and speak. Tell them what is happening to you, because people are hoping if you keep it quiet, that's what gives them more power to perpetuate it. to perpetuate racism. It's not something to hide. It's not something you have done. It's what has been done to you. And do not keep it to be silent, because it is very damaging. And seek mental health support. Seek help. Share your experience with people who are supportive, whether it's peers, and I mentioned that. Next slide, please. If your organization has a diversity, and I say that, okay, I want to go on. I want to mention to seek help. The College of Nurses has a program called Nursing Health Program for nurses who are experiencing mental health challenges or problems, whatever they are. You have that option to go there as well. Next slide, please. I would also encourage you to develop and send a resolution to RNO asking for cultural safety and white privilege education to be included in orientation programs at the university level as well as at your workplace. And some of you might not know what white privilege is, and I'm telling you, it's a new variable for me. I had to look it up. What it means is it's a phenomenon where white people are given privileges, and while people of color are oppressed, and they also promote and support white supremacy. So it's a phenomenon. And I just read an article called by a doctor, a PAC, a nap given to white people, where there are certain policies and privilege that white students or people have that people of color or Black people don't have. For example, I'll give you one from the United States, where they segregated Black people living in different areas to white people. And in their areas, they don't have the same facilities, access to resources as the people who live in the white area. Or the segregation they had on the buses, even in Canada that had occurred, okay? They did not have the same privileges. And today, there are a lot of Black nurses who have degrees, higher degrees, doctorate, masters, and trying to get academic promotions as an assistant professor full-time. They're still having that difficulty. So you have it in the hiring practices. Even if you meet the qualifications, you do not get the job, and somebody who has less qualification than you and is white. So those are some of the things that constitute white privileges. Those things need to be taught so white people know you are given preferences to get X, Y, Z when it's denied to other people. And the only way we could fight racism is to collaborate with our white peers to fight it, because injustice for one is injustice for all. We need to fight it together. It causes great harm. I would ask you to advocate for trauma-informed care and services for those who have suffered PTSD. And for any one of you who know about PTSD and you see it with the soldiers who've been on the battle, how they could commit suicide. We have a guy in Nova Scotia, how many people he has killed because of PTSD. It's nothing to be laughed at. And I'll give you something, it's kind of funny. I was growing up in the Caribbean, and there was a man who had fought in World War II. And he used to march up and down the street and sing all these war songs. And one day I asked my mom, why is Mr. So-and-so marching like that and singing all these war songs? And she said to me that at the time we didn't call it PTSD, but she said something was wrong with him. He had a mental problem that he got from fighting in the war. And so I saw it as a child, and mom, at the time that term PTSD wasn't well known, okay? But they said that was trauma he experienced from the war. Trauma is real. It could lead to depression, it could lead to suicide, and a lot of things that people will do because of trauma. If you are experiencing trauma from racism, you need to get help. Again, we need to advocate for employers to implement a diversity, equity, and inclusion committee with representation from staff at all levels, including volunteers external to the organization, so that people could address this problem. And I am saying the person who is in charge of that committee should have decision-making power. Without decision-making power, you will get nowhere. So advocate for employer or your faculty of nursing to have it in your university. I know many universities now are now implementing such a committee. Advocate for your employer to develop and implement policy on zero tolerance of racism in the school or workplace. Just as there are policies on Code White, there should be policies on zero tolerance for racism. And leaders must be accountable for their practice. It should be not only be embedded into policies, but they should be made accountable for their practice. If they know they are perpetrating, or the staff, they should be held responsible to address racism, and including the Human Resource Department. So share your experiences with peers, get your emotional support and understanding, seek help, support from mental health services if you're at university, and if you're not, seek external help. Other strategies to address racism: advocate for changes in the curriculum requiring ongoing anti-racism education for students, professors to include racism as a social determinant of health. In our survey, 205 people answered the question, and about 8.1% said there was some form of causes like cultural safety or racism as a determinant of health, but it was only on indigenous people, those people who had that cause. So just think about it. It's not in the curriculum. And even the curriculum for clinical practice needs to be improved to include information on people of color. For example, would you be able to, if you've never seen a Black baby with jaundice, would you be able to identify jaundice in that Black child? And this doctor who wrote this paper was saying, so many of his peers who are white, and he wrote out about racism, it's a new article. He said, and they were just joking, he said, they did not realize the privilege we as white people have. I am saying to identify, just use jaundice for example. How many of you have been taught the curriculum? To identify jaundice in a Black person, you have to look at the eyes, the sclera, okay? Conjunctivitis. You have to look at the nail bed to see the yellow. You would not see it in the skin as you would see it in a white person. So we need to include in the curriculum content that address all different races and different peoples, so that as healthcare providers, we are able to provide competent care. So many people in the United States are not given the correct care because they are not diagnosed appropriately and they die. And I'm not going to go into all their stats. So through a student council, advocate for trauma-related support for students who have experienced racism. Advocate for nursing students who are racialized, Black, Indigenous, to enroll or be admitted in nursing programs, such as the FIAT program at McMaster's, which help the Native people in the entrance admission to the university. And at the University of Toronto, there is a program for Black physician students to help them get into medicine at the University of Toronto. Next slide, please. More strategies. Advocate for your employee. So could we skip that slide? Next one. Provide workshops for healthcare providers focusing on white privilege, cultural safety. Develop ongoing meaningful partnerships with Black, Indigenous stakeholders and other community members. We also need to have our white colleagues as our ally to collect data to identify racial disparities and their sources, to have race-based data. And I know the TSB in Toronto, the school there, they did some race-based data and they found out some very interesting information about Black students. And I'm not going to go into further detail. Educate healthcare providers on anti-racism using a variety of ways. You could give grand rounds, write an article in the newsletter, ongoing workshops, orientation for new staff so they understand what cultural safety means, what racism means, what white privilege means. We all need to be better informed in order to be a better community. Next slide, please. We need to recruit, retain, promote Black, Indigenous, and people of color at all levels of the organization. And I can't emphasize this enough. If you were to look at the university level, how many professors are Black, full professors? How many? I have attended 3 Canadian universities, one in Newfoundland, one in Manitoba, and UFT. At the time, I did not have one Black professor. My only professor of color was Dr. Ruth Lee. That's it. Never had anyone else. Today it's changing. And because people are speaking out. But just imagine if you eliminate certain people from leadership roles, how you are missing something very vital and important in society, because we all have knowledge, skills, and abilities and different gifts that we bring. And those gifts that we have, we could do inventions, we could do research, we could bring those to enhance and better our communities. So to deprive people from reaching their full potential is doing them an injustice. So we need to increase the infrastructure and accountability, transparency, and monitoring at all levels and help one another. I'd like to add a few more personal strategies that you could use is assertiveness training. And I remember teaching this to patients in mental health in Manitoba as well as in Ontario in a mental health setting. The purpose of assertiveness training is to enhance healthcare professionals' knowledge and skills in using assertive behavioral strategies. Assertiveness is necessary for effective communication in nurse to nurse, nurse to nurse, nurse to patient, nurse to multidisciplinary team members. It also aids in developing confidence and effective communication skills when speaking to others to avoid manipulative and bullying behaviors of others. So let's start by defining assertiveness. It's an interpersonal behavior that is defined as that which attends to and informs others of one's own needs and feelings and sends the message to others in such a way that neither the person is belittled or put down or blamed. Next slide, please. Assertive behavior is described as a person giving expression of his or her rights, thoughts, and feelings without denying the rights of others. In other words, assertiveness is based on balance. It requires being forthright about your wants and your needs while considering the rights, needs, and wants of others. On the other hand, aggressive behavior is based on winning, while racism is based on traumatizing. Next slide, please. So as an assertive person, you have a right to be heard and not be silent. You have a right to express your views or feelings. You have a right to be respected and be treated with dignity. You have a right to protect your boundaries and remain true to yourself, your wants, your values, and your needs. Thus, you need to understand yourself as well as your strengths, believe in your inherent value, and your value to your organization or team. Next slide, please. So how do we go about doing assertiveness? You use I statements. You say, I would like X, Y, Z, or I need X, Y, Z, okay? Or I feel, or somebody said something very, racist against you, said, I am very disappointed, or I feel very hurt about that statement that you made. Could you explain more about X, Y, Z, okay? So if you have the pattern of behavior of certain persons and team or group, take time to write out the goals you would like to achieve when meeting with them. Find ways to make requests that avoid sacrificing others' needs. Remember, you want people to help you. Therefore, don't be pushy or aggressive.
10 minutes, Dr. Angela.
Pardon?
Oh, a reminder, you have 10 minutes as requested.
Okay. All right. Acknowledge that you can't control other people's behaviors. You are responsible for how people, you are not responsible for how people react to your assertiveness. If they get angry or resentful towards you, try to avoid reacting to them in the same way. You cannot control other people's behaviors, but you can control your behaviors. Stay calm, count to 1 to 10, before answering. As long as you're being respectful and not violating someone else's needs, then you have a right to say what you want and express yourself in a positive way. Next slide, please. And I will say, use the broken record method. That is, you say the same statement over and over until the person understands. For example, the person refers to you as does go, say, pardon me, my name is Joan Doe. Please call me by my name. Next slide, please. Could we go on to the next slide? I'd like to just touch on resilience. Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. Dr. Holly Lee Wei found that positive changes after trauma may result in a positive or negative changes. People have abilities to change their attitude, how they respond to incidents or situations without including, forgiving others. Next slide, please. Some positive changes that may occur after trauma include personal strength, increased positive relationships, new possibilities, recognizing meaning, purpose, spirituality, and appreciation. Don't allow the events of life to break you or to define you. And that's why I hate labeling. I hate the word BIPOC. Don't let people label you. When you were born, you were given a name. Make sure people call you by that name, okay? So in closing, Black and racialized nurses and nursing students need safe spaces to voice their concerns or problems. Mental health programs at universities, workplaces should include trauma response teams to deal with racism. Mandatory health equity, anti-oppressive and culturally safe training for teachers and students. Funding to create culturally safe spaces to facilitate growth and development for students. Last slide, please. Learn to recognize and understand your own privilege and use it to dismantle systemic racism. Examine your own biases and consider where they originated. Validate the experiences and feelings of people of color. Discuss oppression and discrimination. Call out racist jokes or statements. Remember, all forms of oppression are connected. You can't fight against one and not the other. Thank you. And lastly, I like to say, one of the things has helped me to overcome my adversity with racism that I've experienced is learning to forgive those people who have hurt me and not do the same to anyone, to respect people and treat them with love, dignity. Thank you very much. We have a few questions.
All right, thank you, Dr. Angela. Do you have any questions from everyone? You could type in the chat box, or you could open your microphone and you can ask away. I did receive one question here. Question is about, aside from the RNAO's resources and CNO, are there any other available resources or groups that you may be able to share with us?
Right now, I know that some organizations are now establishing inclusion diversity committee that people could go to and voice the concern. I know Ryerson University has one. I know University of Toronto is just establishing one. But the thing I emphasize is it should not be a one-person group. You need people across the organization and volunteers from external. You could also check with your mental health resources online as well, and also check with colleagues who work in mental health if they could recommend some place that you could talk to. I couldn't tell you of any the top of my head, since I'm not in mental health, but check with colleagues who work in mental health and ask them if they know someone who you could go to and look for referral.
Okay, great. I don't see any other questions, but I do have one message here from Leslie. She was just agreeing to you, Dr. Angela. She was just saying, yes, the gas prices are cheaper in the white areas than black areas in the USA. And then another one from Ola. She was agreeing with the information as well.
Okay, so I thank you for attending it. It's not highly researched. The mental health, the impact of racism on people's mental health is not highly researched. I have been reviewing so many articles, over 60 articles. You will find some things about for patients and seeking mental health in the States, but in Canada, there's zilch. And those people who have looked at the impact of racism, it's done not just on Black, but on all minority groups. So it's a good area for research. If you would like to do some research on that to help the Black community or any other minority group. Thank you so much.
All right. I don't see any other questions, but great presentation, Angela. Thank you for those insights and offering solutions to incorporate amazing presentations. Just some feedback. If you have any questions, you could open your microphone and ask away.
All I'd like to say is what is it on behalf of minority groups, like me being included in one of those, like I would like to thank you like for actually putting out that reminder, because like even like mentioning about the micro aggressions and things like that towards minority groups, right? Like that's a big one, like, you know, that we you know, that we experience, like, you know, not just in the you know, outside world, but even in our, you know, clinical settings and, you know, places like that. So yeah, so thank you so much for like, you know, bringing out that reminder again. It seems like I don't know, we do need that reminder, like, you know, for yeah, just being aware of it, you know. And I don't know, yeah, thank you so much for the presentation. It was awesome.
You're welcome.
Okay, are there any other questions or feedback?
So Angela, oftentimes we find nurses said that I just don't want to be labeled. If I complain or perceive that I'm complaining, then I've been labeled, that I'm a troublemaker, that I would not be considered for any kind of promotion or even have the privilege like others to go to a conference and things like that. So what do you have to say to a nurse that who is feeling very vulnerable and feel that if they should speak up, then they will get punished?
A lot of nurses are afraid to talk to the manager, and you have to do your assessment of what your manager is. That person open and respectful to hear? And are they having fair practices? And you could tell a lot about the manager, even the way they assign assignment if you're in the hospital setting, okay? Or who is going to what conferences. You already know that certain people are getting preferences. And that's why you have to go to the top. I will go to the top because you know what? The people lower down, they get away with it because the people who are experiencing the racism, they're afraid to speak because they feel they will be penalized. Okay, so they go to the top and meet. We shouldn't be afraid. You have an English speaking tongue or whatever the language is. If you're French speaking, go to the top and make sure you have your documentation and examples. When I experienced racism before, I did not even know I was experiencing racism. What I was able to share was, this is what is happening to me, and this is not right. And anybody could understand what is right and what is wrong. I didn't even label it as such because I didn't even know what racism was. So I am saying, you go to the senior executive person in your institution, whether it's at the dean level or whether it's at the director or higher than that, because it should not be tolerated. And it's time that people share this information so that steps are taken. Leaders have to be accountable for their behavior and stop perpetuating white privileges or giving special treatment to special people.
I have a comment here from Natasha. She just said, after listening to you, I can recall one episode where it happened to face racism during my studentship, where I prefer to turn back and not face the aggressor. I have another one.
That's why racism continues to be perpetuated, because people who experience it are afraid. It's to intimidate you, okay? So if you don't speak, it stays on the ground, but it goes on all the time. It's not solving the problem.
This is Leslie here. I enjoyed your presentation, and I could attest to some of the things that you're talking about, because I did my nursing in the UK and then moved to America. And both countries, they do have the microaggressions, they have everything underlying for people of color to actually succeed in a nursing profession. They had a thing that they used to say on the floor in England, keep it white and tight. That's what they used to say. And that was a kind of, I would say, like an oppression in a kind of way, because you couldn't move forward. All the nurses would go forward into bigger positions that were white, and the people that were of color, brown, they won't go anywhere. You had to literally fight for you to get to be seen, or to be known, or to get what you need in your profession as a nurse. So I do understand what you're saying, and it's not that you don't want to say what's going on. It's just that they lie. They put stuff together and they will stamp you out in a minute. That water won't wash it when they're done. So that's why some people prefer not to say anything. It's not that you don't have the gumption in you to fight. It's just that you're fighting a losing battle. That's what it is.
And that's why we have to make leaders accountable. Racism exists. It's embedded in our society, in our institutions. It's under the structures, the processes, whether they're hiring processes, they are embedded in our society. And we have to collaborate with our white colleagues to dismantle racism. We cannot do it alone. And we need to educate our colleagues, our friends, to tell them it exists. And I will say that I have had white colleagues who are very empathetic. Like I tell you, in Newfoundland, all my colleagues supported me. Without their support, I don't think I would have ever graduated with my BN and moved forward.
Yes, I agree with you on that, Dr. Angela. I also actually was in Newfoundland before. I worked there too, and people there are very, very nice and very, very supportive. So I agree with you on that. I do have one more comment here. We have much work to do here. It will take us all of us working on this together. A great resource I want to share, so she have that in the chat box, New Leadership Institute. And then she said, we need to start with increasing our own awareness and must be part of our system transformation. So leadership start with each of us as individuals using our voice. So this was very good.
Thank you so much. Yes, we all have to collaborate. We were all, I will just share something. It's a brief story. I was living in Newfoundland, and on days off, we used to go into the woods. And in the summer, all those beautiful flowers come out together. And one day I was sitting there with another colleague, and you see the brown and yellow flowers and the white, and they all came up, and they were so beautiful. And I was saying how beautiful the things of nature are. And I think when my God, I am a Christian, looks at his creation, all color, all race, all people, how beautiful we are. And yet some people feel they're better than others. Could the white flower say it's better than the yellow or the brown or the green? They blossom, they give beauty to the rest of the world. Why are we as human beings with high intelligence behave in such a negative way? We have to learn to embrace the values and also the talents of other people around us to make this world a better place.
I agree with that. Is there any other questions from anyone? You could open your microphone. I do have a lot of thank yous and great presentation, feedback, very, very good feedback, Dr. Angela. Do we have any more questions? All right. Seems like we don't have any other questions, but a lot of feedbacks, like I said. Thank you very much, Dr. Angela, for the very, very wonderful presentation. We are very, very happy to have you today. Thank you for sharing your experiences with us. Certainly a good learning, and thank you for generating a deeper awareness on systemic racism. Thank you so much.
You're welcome, my pleasure. And I look forward to collaborating with you and all my colleagues at CARE. Take care.
All right, this concludes our webinar. Thank you everyone for joining us today. We will have our next webinar on June 16. It will be regarding the founding member agencies, looking forward and looking back, and May 14 as well, palliative care, and May 27, how to prepare for interviews. Hope to see you all join us again, and happy Nursing Week, everyone. Take care and stay safe. Thank you, Dr. Angela.
Bye-bye.
Bye, everyone.
Bye.
Bye.